This is the CAP5 test, and this is question 5. And this shows a test that's been developed to find out if a person that has antibodies to HIV, ELISA. The test only detects the presence of HIV antibodies to give 2 reasons why it cannot be used to find out if a person has AIDS. Okay, so HIV is the infection and the virus. AIDS is the condition that the virus might lead to. So for AIDS, we need to look for symptoms of AIDS. Things like the person having pneumonia or kind of secondary infections. So need to look for symptoms that are related to AIDS, e.g. pneumonia. And then another way to do the cells, so you know that AIDS reduces the number of helper T cells. So that's what you'd be looking for as those are destroyed. So need to look at number of helper T cells. Those would be reduced. Part B, a solution will remain yellow if they're not infected. Explain why. Well, if they're infected, it's going to be blue because you'd have the antigen, and then in the blood plasma, you'd have the antigen on the dish. The HIV antibodies would be in the plasma. They would bind to the antigens. The second antibody would attach, and then that would stay there. Then the enzyme would be present, and that would go blue. So basically, if the HIV antibody is not present, then that second antibody with the enzyme won't bind this second antibody here, because that's then going to have the enzyme that's going to change the colour. So the HIV antibody is not present, so they won't bind to that antigen. So the second, this one, so the second antibody won't bind, and so won't be present, will not bind, is not present. So that's going to lead to the colour change. Part C, a mother who was infected with HIV gave birth to a baby and the baby tested positive. This does not prove the baby's infected with HIV. That's relying on your knowledge of what's passed from the mother to the baby, including things like antibodies. So the child would receive HIV antibodies from the mother, and so that would turn the solution blue. So baby receives HIV antibodies from the mother, and so will always be positive. And that will turn blue, certainly for the first year and a half or so. Part D, control was set up. Everything was done exactly the same apart from no blood plasma was used but was replaced by salt solution. Two purposes of this control. Well, we need to make sure that nothing else is causing this colour change. So it's the antibodies attaching to the enzyme that causes the colour change. So only the antibodies, leading to the enzyme colour change. So in controls, what we're trying to do is make sure that it's our independent variable. In this case, antibodies are not that causing the colour change. We don't want anything else causing the colour change. So the important thing here is nothing else causing the colour change. Because if we use this salt solution and there's a colour change, then we've got a problem with our test. Also, we need to check one of the procedures, step 4, to make sure that if we just use salt, then this washing should be effective. It should wash all of anything that's not attached. So this second antibody should get washed away. So to check washing is effective. So all that second antibody, it shouldn't attach to anything, and so it should get washed away. So all unbound antibody is washed away.